Hi, this is Megan Williams. I did my poster project on mind-body medicine and how it impacts anxiety in cancer patients. The clinical question is, in patients with cancer, does mind-body medicine compared to traditional medicine alone help in decreasing anxiety symptoms? Cancer is not only just affecting the physical being, it also affects psychological on the cancer patient, and this could be effective with mind-body medicine because mind-body medicine focuses on psychological. About 40.5% of patients use mind-body medicine right now. The significance is that in 2007, 10 million people in the U.S. were diagnosed with cancer, and cancer being a whole body experience, not affecting the physical and psychological person, it needs a holistic approach. 64% of the cancer patients did have anxiety, and anxiety can lead to psychological distress, which then can lead to poor outcomes for these patients as well as a longer hospital stay. With mind and body medicine, it was shown that anxiety was reduced in these patients. Process of literature search was through databases of CINAHL, EBSCO, and WorldCat. There was keywords of CAM, which is complementary alternative medicine, as well as holistic, cancer, and anxiety. Search limitations included peer-reviewed, 2008 to present, as well as full text journals, academic and nursing journals, and it had to be in English. The results ended up yielding about 76 journals. Of those, I narrowed it down to 3. The first being by Lancashire et al. Is a pilot study that evaluated mindfulness-based stress reduction program in cancer patients. This program looked at not only the physical symptoms but also the psychological symptoms as well as quality of life and cortisol levels. It was as mentioned, a pilot study that had a one-group quasi-experimental pre-test, post-test design. This group used instruments such as the perceived stress scale as well as anxiety scale and looked at physiological, psychological symptoms, quality of life, and cortisol measures. The results for this study did show reduction in anxiety and other psychological symptoms, but there was some limitations. There was a small sample group size as well as a lack of follow-up and a lack of a comparison group. The second study by Lai et al. Is a study that focused on looking at body, mind, and spirit group interviews. This looked at both quantitative and qualitative data through a randomized trial and a focus group. The focus group ended up being the experimental group, which was about 12 patients, and the control was 16 that received physician usual care. This used Beck's depression scale as well as anxiety state scale for the quantitative, and then it used open-ended questions for qualitative. It resulted in a reduction in anxiety as well as a reduction in depression. There was some limitations being that it was a single-blind study. It did have a lack of follow-up, and there was a huge reduction in the subjects that were originally supposed to be in the trial. The third study, Johnson et al. Looked at integrative medicine and how it affects pain and anxiety. This looked at electronic medical records with the permissions of the physicians. It was about 10,000 hospital admissions that narrowed down to 1,800 based on the use of integrative medicine. These patients, they looked at their pain scale and anxiety scale, and that's how they were able to come up with the results of 46% reduction in pain as well as a 56% reduction in anxiety. This did have some limitations of it did not take into effect opioid analgesics as well as a lack of follow-up, and it was self-reported pain and anxiety which can affect the study. Recommendations for this trial include follow-up on long-term effects. There was a need to provide comprehensive nursing as well as looking at the effects of opioid analgesics. In conclusion, cancer patients require holistic nursing care, and through studies discuss anxiety was reduced in these studies of mindful mind-body medicine, and it suggests that in future studies to look at follow-up care to see how these interventions work. Thank you.